Well, one of the things about hair loss people always talk about is their confidence. It's very strange. And I'm going to tell you today some of the ways that we can actually be proactively doing something before that starts to hit pretty hard on us, eh? And in this case, definitely prevention is going to be better than cure. And the philosophy I'm going to share with you is about the PRP. Many treatments, but I'm going to focus on something that most of the clients have been very intrigued about: natural results, having natural ways of actually enhancing it. So I'm gonna give you some information about the PRP and why it's been so much being spoken about, and what actually it does and what qualities it has, right? So you would have heard probably PRP and growth factors, PRP and growth factors and growth factors. So I'm just going to give you a very simple breakdown about what growth factors. So PRP is platelet-rich plasma, which is circulating in our blood. So it's there everywhere in everyone and every day. Obviously, depending on the health status, it can change a little bit. People who are using substances, medical conditions, we know that those change with aging. We know that it changes, but again, it's an individual approach. That's my way of looking at it. I had tremendous results with diabetic clients who tend to be actually not favorable clients. But again, I would strongly suggest you look into the medical aspect of it, exclude what's going to be detrimental to the success, and then have an individual approach. And we've got tremendous results. We would like you to have the same thing, okay? So some of the growth factors that we are going to talk about today, and there's a growth factor called platelet-derived growth factor. So what is this platelet-derived growth factor? Platelet is platelet, derived is from the platelets being taken out. They actually attract the repair cells. So when there's a tissue injury, right, immune system recognize it, and then it sends, first of all, the combating cells, neutrophils, basophils, monocytes, white blood cells, to go and attack it, see whether there's anyone trying to get into our system, and then destroy it. In the meantime, we also have what we call the macrophages and fibroblasts, which go to repair the damage. And that's where they will make what we call a fibrin net. And then the platelets go and get burst out there. They'll release those biologic active substances and will release these growth factors. And that's where the wound healing starts. So when you see that yellowy, discolored substance coming on top of the wound, that's the process of fibrin plasma going in there to repair the process, all right? So the platelet-derived growth factor is actually responsible for the wound healing, right? So, and it also helps in bone regeneration, because this is where what we call as a little bit of a stem cell philosophy comes